CADASIL is a monogenic vascular dementia condition. It is caused by variants in the NOSH3 gene that span pretty much the entire gene. So the disease presentation can be very heterogeneous, depending on where the location is, possibly also depending on modifiers, risk factors, environmental factors. All of that research is still kind of undergoing review. The most common presentation will be people in their 30s and 40s start with migraines, strokes, recurring strokes, and then cognitive decline kind of at an early age compared to other conditions like Alzheimer's or just older age causing those problems. And so a lot of the people that come up with CADASIL at first get misdiagnosed like MS. And then depending on what imaging is done, usually if they get an MRI of their brain, the presentation for CADASIL is kind of specific with the white matter changes and their localization. And that's when like kind of that light bulb goes off on people to get the NOSH3 testing. So most people nowadays get diagnosed with a targeted NOSH3 genetic test. Before then, it was a skin biopsy and kind of looking around the blood vessels for these deposits that are called GOMs, or granular osmiophilic materials. They're very striking, very unique to CADASIL, but unfortunately not every CADASIL patient has those. We know what the genetic cause of CADASIL is. We don't actually know what the mechanism of CADASIL is because it spans the whole gene. It modifies the protein that is on people's smooth muscle cells in different ways. It could be in the extracellular space. It could be in the intracellular portion. It could be in the intracellular portion of the molecule. And so it's been very difficult to figure out what is actually happening on the molecular level. We know the GOMs are happening right outside those smooth muscle cells or those parasites around the blood vessels. And we think that that is sort of what is causing the decline of the blood vessel health there. The smooth muscle cells kind of start degrading, and then that communication of endothelial cells also starts breaking down, and then the blood vessels become leaky. And in particular, the brain blood vessels are more affected than anywhere else in the body, even though this NOSH3 is expressed in the whole body. And so because we don't know the mechanism, it's actually very difficult to know how to treat CADASIL. So right now there is no cure. And everything that is done to just address the individual symptoms that people are presenting with. And so a natural history protocol or study like what we have allows us to look at the phenotype of the disease and understand what's happening from the symptomatic side. Try to link it to the genetic side. So we're trying to make phenotype-genotype correlations. But it also allows us to obtain samples from the patients, whether it's blood or a skin biopsy or even spinal fluid to try to find biomarkers that can help us should we find a treatment, figure out if it's helping or not. So say that there is a circulating molecule in the plasma of patients with CADASIL that we can identify, then that can be an endpoint for a future trial that is a treatment trial. And two, obtaining blood and skin biopsies allow us to create cell lines from these patients that eventually will allow us to make in vitro models of the disease and study the molecular mechanism in more detail. So the natural history studies are extremely useful to understand the disease, but also as preliminary data for FDA to be able to make a call on a treatment or not down the line.